Hello and good afternoon friends, welcome to CEC-UGC live lecture. Dear friends, as you know that we are carrying a series on cancers, and under this series we are discussing about numerous types of cancers. Today also we are going to discuss on one of the major cancers, the cancer which is most prevalent among women. We are going to talk about gynecological cancers, and for this we have with us in our studios Dr. Shruti Bhatia. She is a senior consultant gynaecologist. So first of all, I would like to welcome our guest Dr. Shruti Bhatia, and I hope that all the viewers who might be watching us right now would be benefited from this particular lecture, and I believe that the things which you tend to skip or you take them vaguely, I hope that from now onwards you are going to take all these things into consideration. So first of all, I would like to welcome our guest Dr. Shruti Bhatia. Welcome ma'am, welcome to the EDUCET lecture. We have discussed or we have heard about lots of cancer, but when we talk about gynecological cancers, we are blown out. I mean, we think and tend to think that what kind of cancers it could be. So I wish that this session is going to be very productive, because we are going to learn more and more through you.
Actually, in India, a lot of females, they do not take care of their health. They are not worried whatever problems they have. For them, their family and their kids come first. So I want to make people aware that there are certain important cancers. In fact, it will be a shock to everybody. In India, cancer cervix is such a common cancer that if you consider the whole world, approximately 20% of the cancer burden is from India alone. So you can imagine, which is such a big cancer which is affecting so many females, and then people are ignorant about it. So I like to tell you something about the cancers that females have and the cancers that are related to gynecological organs. As you can see in this diagram, this is the uterus, as many people would be aware of, uterus, tubes and ovaries, and this is the cervix, what we call as the mouth of the uterus, and this is the vagina, and which is the passage to the birth canal, as many people are aware of it. Cancers can happen in any organ of the body. A cancer can arise from the uterus, from the ovary, from the cervix, from the vagina. But most commonly in India, the maximum incidence is of cervical cancer, which arises from the mouth of the uterus. Second is uterine cancers, or cancer arising from the body of the uterus, or the ovarian cancer, which arises from ovary or andedani as people know it. A word about cervical cancer. As I told you, it is the most common cancer in Indian rural females. Approximately 1.2 lakh new cervical cancer cases are diagnosed in India every year, and of these, approximately 70,000 women die of this particular cancer every year. About what happens, what causes cervical cancer? Of all the cancers, we know this is one cancer which is caused by a viral infection, which is HPV, human papilloma virus infection, which causes cervical cancer. It's a viral infection which is spread by sexual transmission through perinatal route. When a child is born to a mother, if the mother is having this infection, then a child gets this infection, or sometimes through fomites. There are various factors, not only HPV virus infection, but there are other factors which are responsible for formation of cervical cancer. Most important is immunosuppression, like people who have HIV or other form of autoimmune disorders, they are prone to get cervical cancer. Smoking is a very important factor which makes it possible for HPV to cause cervical cancer. Then in India, as you know, a lot of girls get married at younger age. They start living with their husband at a very young age. This early marriage, early sexual activity causes cervical cancer to happen in so many Indian females. Then people, those who are having multiple sexual partners, because as I told you, HPV is a sexually transmitted virus. So it's kind of, you can say, a sexually transmitted disease which causes later on to be converted to cervical cancer. Now the best part is cervix, as I told you, the mouth of the uterus, does not form cancer immediately. It is a normal cervix which gets HPV infection, then through various stages it goes and forms cancer. We call them pre-cancer or cervical intraepithelial neoplasia. These are pre-cancer stages, and the best part of this organ, you can say, it does not get converted to cancer in few months. It takes approximately 8 to 10 years for cancer to be formed. Female gets this HPV infection, then there are other cofactors which take part and get it responsible to formation of a pre-cancer stage, which is called CIN1, and through other factors, if the immunity is down or if the virus is very strong or if the viral load is very high, then it gets converted to CIN2 or 3, that is pre-cancer stage, and finally it gets converted to cancer. So we can say that God or the disease has given us so much time when we have to rectify this disease, to correct this disease and take proper measures so that this cancer does not get formed. Something lot of people ask us, Dr. Saab, how will we know hame cancer hua hai? So what are the symptoms of cervical cancer? Most important, lot of females don't have any symptoms. They just said we got a test done or we have just come for routine checkup, and when we do their checkups we find that cervix is not healthy, and then we detect cervical cancer. Otherwise, many females just have excessive vaginal discharge, which so many females take it as a normal part of their life and do not get treatment. Lot of females present to us with abnormal bleeding, which could be postcoital bleeding or intermenstrual or a postmenopausal bleeding. That is, ladies who have completed their menstrual cycle, and even after finishing their menstrual cycle they start having bleeding or start having discharge. That could be a sign of cervical cancer. Sometimes people just have pain in lower abdomen or urinary difficulty or just uneasiness, and they come to us and we diagnose this cancer. How do we diagnose this cancer? As I told you, lot of people come to us and there is a simple test called pap smear, which I will tell about you later. It is a simple test by which we can detect if the female is harboring any cancer cells, or as I told you before, as she is harboring any pre-cancer cells. Pap smear can tell us if it is a normal cervix, inflammatory cervix, it is a pre-cancerous cervix, or if the cervical cancer has already formed. After that, if there is any pap smear abnormality, we do a biopsy. Normally it is called colposcopy directed biopsy. We see the cervix through a machine. It is something which machine is outside the human body, and under bright light, under magnification, we visualize the abnormal area and take a biopsy. And then as and when required, sometimes we need to do ultrasounds, MRI or CT scan for the patient. Now something about a pap smear. Pap smear is something which all females should be aware of, all females should get it done. In fact, in America and in European countries, it is part of their routine daily life. There are national programs, there are government run programs, and every female has to get it done once a year or once in 3 years. Basically, it is a spatula, it is a wooden spatula through which is inserted inside the vagina. It is the scrapings are taken over the cervix. We put the scrapings on the slide and then send it to the lab. It is just 2 minutes job, and if a female gets it done regularly, she can be rid of this cancer, or she can detect this cancer in a very early stage. Okay, now we have diagnosed it to be cervical cancer. Can we treat it? Of course, we can treat it. The best part of cervical cancer is if we diagnose it in early stage, more than 90% of the times people go on and lead normal, happy, healthy lives. We do a staging of the cervical cancer. Staging is done by surgery, by examination, by tests like ultrasound, MRI, and once we diagnose the stage of cervical cancer, in early stages the treatment is surgery. By surgery we remove the abnormal area, the uterus is removed, the cervix is removed, the surrounding lymph nodes are there, we remove that, and then the patient is cured of the disease. Even if it is a later stage, stage 2, stage 3 or stage 4, even in those cases we have treatment where we do radiation. Radiotherapy is done along with chemotherapy, which can cure the patient of the disease in 80% of the cases. and a person with cervical cancer in most of the stages, if detected early, can lead a normal healthy life after treatment. As I told you, can cervical cancer be prevented? Yes, it can be prevented. Of all the cancers humans have, this is one cancer which can be prevented in most of the cases. We need just few modifications in our lifestyle, few preventive measures by which we can prevent this cancer. As I told you, lifestyle improvement, no early marriage, no early children, and not having multiple partners, all these things can prevent cervical cancer. Avoid smoking, we can avoid cancer. As I told you, cervix is one part of the body which is easily accessible. Every time you go to a gynecologist, she will examine it. Simple examination by naked eye, simple examination by a trained doctor can tell us if there is any abnormality, and cancer can be detected and treated. And as I told you, there is a long treatable pre-cancer stage. At that time, if we do any therapy, there are a lot of treatments available which we can do to prevent cancer formation. We have very good screening methods like pap smear. There are other methods available, like there is a HPV testing. As I told you, HPV is a virus which causes cervical cancer. If we can detect HPV infection, we can detect that patient can develop cancer, so we can treat it there and then and prevent cancer formation. And now, for past few years, we also have a vaccine for this HPV virus. This virus can be prevented, it can by a simple vaccine. It's just like a tetanus injection or a DPT injection. Everybody, in fact, everybody gets it done in their childhood. This is also a simple injection by which we can prevent cervical cancer. Two vaccines are available. I think all of you would have heard about this in the media. There are two vaccines available in our country, and 3 injections over 6 months' time can prevent this infection. There are 2 vaccines available, which is by 2 companies world over. They have been advocated and they are being used world over, and very good results are available. If all the girls before their marriage get this vaccine, and then they can prevent themselves, in 98% of the cases this cancer can be prevented. I will tell you something about endometrial cancer, that is cancer of the body of the uterus or the cancer of the womb, what we call it. This is the body of the uterus or the womb, or बच्चेदानी जिसे हम कहते हैं, and this is where this cancer starts. It is not a very common cancer in rural India, but in metropolitan cities its incidence is rising. In fact, with our lifestyle changes, as our life expectancy is increasing, its incidence is rising in India, and in females it is the 7th most common cause of cancer in India. What are the symptoms of endometrial cancer? Most of these females present to us with some or the other form of abnormal bleeding. Their menstruation cycle could be irregular or heavy, or females who have finished their menstruation after menopause, they start having bleeding. Some females present to us with abdominal pain, and on examination we find that there is a cancer inside the uterus. Sometimes they present with abnormal vaginal discharge. There is a lot of discharge which is there, and when we see and do testing, we find that it is an endometrial cancer. Or sometimes it is plain abdominal distension or pain abdomen. What are the risk factors for endometrial cancer? As I told you, with the increasing life expectancy, we are seeing more and more cases of endometrial cancer. Also in obese patients, in females who are obese, they get lot of endometrial cancer. There is a rising incidence of diabetes in India. There is rising incidence of hypertension in India. This triad of obesity, hypertension and diabetes is a major risk factor for endometrial cancer. Then excessive use of hormones, like lot of females take hormone replacement therapy after menopause. These hormones can be responsible for endometrial cancer. Or females, those who start having menstruation cycle early, we call it early menarche, or females, those who develop menopause later on. Normally menopause is around 50-52 years of age. Lot of females keep having menstrual cycle even after 55-60 years of age. This is the time when females get exposed to more of estrogen hormone, and because of this prolonged exposure to estrogen hormone, there is formation of endometrial cancer. Then PCOD, lot of girls of younger age group have PCOD in our country. PCOD is one disease where there is excessive estrogen hormone in body, and this leads to formation of endometrial cancer in their later life. Another very important factor in endometrial cancer is genes. Our genes are a very important factor for endometrial cancer. This is one cancer which is transmitted by genes from various generations, like a grandmother has it, or mother, or our aunt. All these factors predispose to a female having endometrial cancer. How is endometrial cancer diagnosed? Simple test. A routine examination by gynecologist can give you an idea if there is any abnormality in the uterus. Simple tests like ultrasound or a test MRI, CT scan. These tests can tell us if there is any abnormality in the uterus. By this we can detect, okay, this abnormality is there. Now we need to take a biopsy from this. So a hysteroscopy or a plain endometrial biopsy can confirm if there is any formation of endometrial cancer. Again here, cancer formation does not take place in a minute. We have a normal cell, then we have precancerous cells in the body, and then endometrial cancer is formed. So by biopsy we can detect both the precancer as well as cancer formation in the uterus. It's one of those cancers which can be easily treated and has a very good success rate. In fact, lot of our patients who come with early disease, stage 1 what we call as you know, all cancer are divided into 4 stages. So endometrial cancer patient who comes in early stage has a life expectancy almost as a normal female would have. It has such a good cure rates that we tell it's a cancer which has a very good success rate. So a simple surgery where we do a total hysterectomy, the whole uterus is removed along with the cervix, both the ovaries and adjacent lymph nodes are removed during surgery, and once they are removed, the patient is cured of surgery. Sometimes in few cases, if the disease is a bit advanced like stage 2 or stage 3, then sometimes we need to add adjuvant radiation therapy after the surgery. Even with addition of radiation therapy and surgery, a patient lives a normal life like a normal person without cancer. Something about ovarian cancer, which is also very prevalent in India, and the worst part of this disease is that it does not have any symptom. Most of the females will not have any problem or any symptoms related to this cancer, and when they come to us, they will usually present in advanced stage. It is one of those cancers which is causing mortality or death in maximum number of cases. The incidence is rising in India because life expectancy is increasing, and many of these cancers present in a later age group. As I told you, the worst part of this cancer is there is no symptom. Patient does not have any abnormality, except some will have a bit of gastritis, डॉक्टर साहब पेट थोड़ा सा ख़राब था, थोड़ा गैस हो रही थी. That is all what maximum number of patients would tell us. They will not have major problems, and most of the times they take it, डॉक्टर साहब कुछ एंटासिड ले लिया, कुछ पेन किलर ले लिया, and the cancer goes undetected, undiagnosed till it presents in advanced stage when patient has so much symptoms. Then they come to us for those symptoms, and when we diagnose, it is already stage 3 or stage 4. There is only pain, abdomen and distension and GI symptoms which lead on to diagnosis of ovarian cancer. Again, this cancer has so many risk factors. As I told you, age. Most of these cancers present in advanced age. When a lady comes to us, 60-year-old lady who comes with pain abdomen, who comes with these GI symptoms, we have to keep the suspicion of ovarian cancer very strong. So we diagnose the cases or we manage these cases accordingly. But The worst part is this cancer also presents in young age group. Lot of girls, adolescent girls, 6-year-old girl, 12-year-old girl, they will have ovarian enlargement, pain abdomen, and they will come to us with cancer. Even these cancers can present in younger age group also. So, ovarian cancer is one thing which presents both in younger as well as in elderly age group. A major causative factor for ovarian cancer is obesity. As with other cancers, obesity is one problem which can be responsible for ovarian cancer as well. Hormonal therapy. As I told you before, lot of females take hormones for postmenopausal symptoms as part of HRT, or hormones for other things like part of infertility treatment. These hormones can lead to the formation of ovarian cancer. Sometimes lot of females take tamoxifen, which is a common drug which is given to females who have been treated for breast cancer. Tamoxifen is one drug which is very beneficial for breast cancer, but for uterus as well as for ovary it is a harmful thing. It can cause cancer in these patients. Then family history, another very important factor. Lot of females develop ovarian cancer because of their genes. You all would have heard about Angelina Jolie. Angelina Jolie was famous, is still famous for mastectomy she has done because she got herself tested for genes. There is something called BRCA1, BRCA2 gene which is responsible for familial cancers in both uterus, breast and ovarian cancer. Angelina Jolie had a high risk for breast cancer, that is why she got bilateral mastectomy done, removal of both the breasts. But she also has very high risk for ovarian cancer because of her genes. So, similarly other females also have very high cancer for ovarian cancer if they have a positive family history. And then as in most of the cancers, there is idiopathic. There is no reason for so many cancers. Similarly, for ovarian cancer sometimes we do not find any particular reason. As there are risk factors, so there are protective factors also. Females who breastfeed their child, when females breastfeed there is less of ovulation, or we say less of egg formation in the ovary, hence less of cancer formation. Oral contraceptive pills, females who take oral contraceptive pills for a longer time, they also have protective factors which are responsible for protecting ovary, and hence ovarian cancer can be prevented. How do we diagnose ovarian cancer? Again, simple examination by a trained person can give us an idea if there is abnormality in the ovary. Simple test like an ultrasound. Ultrasound will tell us if there is any formation of any mass in the ovary, if there is formation of any mass in uterus or in the surrounding region, and if there is a suspicion of ovarian cancer, it can be easily detected. This is one of the easily accessible tests which can be done, I think, in any part of India. Ultrasound machines are available. A simple test, non-invasive test, can detect and diagnose ovarian tumors. Then there are certain tumor markers which are specifically present for ovarian cancer. One of them is CA-125. Lot of people would have heard about it. It's one tumor marker which is elevated in ovarian cancers, and it is also elevated in other problems, but this is one marker which is very important for ovarian cancer. Then, as I told you, young females also develop ovarian cancer. In those females, there are other markers available like alpha fetoprotein, beta HCG, and other markers are there. Then there are tests, as I told you, CT scan is available, MRI is available. By these tests, we can know the type of tumor, how much the tumor has spread, and what are the possible ways which we can treat it. This is one tumor which spreads like a flower. I say it spreads like a flower, it opens up. The tumor starts from the ovary here and spreads all over in our abdominal cavity. It spreads on the liver, our intestines, there is omentum, there are nodes, and it's a tumor that spreads all around in our abdomen. It can also spread to lungs. It spreads by direct spread, we call it transperitoneal spread, or a lymphatic. Lymph nodes in our body are there which take the tumor to various parts, or hematogenous through blood supply. As I told you before, although this tumor presents to us in late stage, but still nowadays with advancement of science, there are so many treatment options available to us by which we can treat this cancer. Among the most two important are surgery, where when we do a laparotomy, we remove the ovarian mass, remove the uterus, both the ovaries and all the abnormal areas that are present in the body. We can remove all the tumor cells in our body, and we combine the surgery with chemotherapy. Chemotherapy is easily available in metropolitan as well as in other cities. Combination of these two treatments, surgery as well as chemotherapy, can treat cancers even in advanced stage. So, when the patients come to us even in stage 3 or stage 4, we treat them with these two modalities and they come with very good results. A word about screening of our ovarian cancer. This, as I told you, genes play a very important role in this cancer. So, all the ladies who have some family history of ovarian cancer or uterine cancer or breast cancer in their family should get a screening done for ovarian cancer as well. Ultrasound abdomen and a CA-125 level, two simple tests, ultrasound from any trained radiologist and a CA-125 levels from any proper biochemistry lab will give us an idea if there is an increased risk for ovarian cancer, and if there is a risk, then we can get it thoroughly checked up and examine ourselves and treat it at an early stage and can prevent formation of this cancer, so that early detection is always the best treatment. Thank you.
Thank you, ma'am. Thank you so very much for making us aware how this gynecological cancers could be a disaster, although every cancer is disaster. But now the question arises here, as you said, about the screening. What basically is screening, if we talk about this particular term in layman's language? What basically a screening is? Is it the person should go regularly for the checkups, or it is about diagnosing a kind of a thing?
Screening is something what we call a normal person getting checkup done so that a disease can be detected before it causes symptoms. We say diagnosing a disease before it appears with signs and symptoms. So, screening modality is something where a person goes to a doctor and simple tools are available. We call it screening tools, by which we can detect a particular type of disease. Sorry to say, but in India we don't have any particular screening programs. As I told you about cervical cancer, a pap smear test world over, it has been recognized by regular screening tests in USA, in Europe, in Japan, in so many countries. There is a regular screening program. The females get annual pap smear done, and by which this can be detected in early stage, and just plain modality of screening has helped in reducing cervical cancer a lot in these countries. In India, we don't have any screening program, but what we call it, I say to these my patients, opportunistic screening. Whenever you get a chance, go to your doctor, go to your gynecologist, get a screening test done, which is nothing but a simple pap smear by which we can detect cervical cancer. As in cervical cancer, there is pap smear. Similarly, in ovarian tumor, as I told you, there is ultrasound and CA-125 levels. They are not very sensitive screening methods, but pap smear is one thing which is a very sensitive method for detection of cervical cancer. A female gets an annual checkup done. Everybody gets a checkup done for their cars. We have a checkup done for everything in our home except ourselves. So, I think everybody should take a pledge, get an annual checkups done, in which a pap smear should be part of their routine checkup. A gynecologist will do it. There is a simple wooden spatula stick by which a scraping is taken from the surface of the cervix. It is sent on the slides, 2 minutes job and no pain, and then we know what results in 3 days, and we will know if there is cancer formation or pre-cancer. If it is pre-cancer, we can detect, we have detected it early and we can treat it. If there is absolutely normal, fair enough, get a pap smear done after 2 or 3 years. Another test which is coming up nowadays is HPV virus detection. As I told you, cervical cancer is caused by human papilloma virus. If we can detect this virus in our body, we can detect that this lady is at increased risk of getting cancer in her future life. So, HPV virus test is also done. The test is similar to pap smear. If both these tests are negative, 98% chance is there that this female will not get cervical cancer for next 3 to 5 years. Nowadays we recommend any female who has got these 2 tests done and they both are normal, for next 3 years no screening required, she can come to us again after 3 years and we tell her, okay, relax, you are not going to get cervical cancer.
This is a very important point you have laid here, that for about approximately 2 to 3 years we can say that the person is not going to get such kind of cancer. Could we say that because of this kind of screening, if person goes through, and we can say that with the advent of technology now it is easier to predict that yes, the person is likely to be affected by the cancer or a particular kind of cancer.
Yeah, these technologies do help us. They tell us, fine, okay, the risk is high or the risk is minimal. Then if we know that the risk is high, we keep the patient under close observation. We ask her, get regular checkups, or there is another test, colposcopy, as I told you. We can also do those tests for her and see if there is any abnormality being formed. We can treat it there and then. There are simple procedures, we call them cryotherapy, or excision of the local area. She does not have to go through a major surgery. And even if there is a, as I told you, pre-cancer 1, 2, 3, lot of females are aware about it, and we detect these cases in pre-cancer stage. So simple procedures can prevent cancer formation and they can henceforward lead normal lives.
Once the cancer is detected, now the question arises, does the person has chances of getting that particular kind of cancer again?
Yes, you are absolutely right. There is definitely term recurrence of cancer. It happens in all these cancers, not only gynecological cancers, but in all cancers there is a term called recurrence. After we have completed the treatment of the patient, we ask her to get regular checkups done. Normally we say in gynecological cancers every 3 months for 2 years, after 2 years every 6 months, and then after 5 years once a year. Every time she comes to us, we do a detailed examination for her, simple tests like ultrasound or a pap smear or simple blood test by which we know the problem is okay or there is a recurrence being happening. The site of recurrence cannot be predicted, but in certain cancers we know, okay, this is the most common site of recurrence. So we try to see those areas, and then everybody would have heard about a test called PET-CT. I mean, a lot of patients come to us, doctor, PET-CT kya hota hai? Cancer diagnosed hua nahi, PET-CT. So PET-CT is also another method. It's like a CT scan done with the help of a dye, and that detects if there is a recurrence. Whenever we find suspicion, a PET-CT is done so that we can detect recurrence and the site of recurrence early.
As we always say that prevention is better than cure. In fact, the doctors themselves says that the prevention is better than cure, because doctors themselves believe that the less number of patients should come to them, although it is their profession that they should treat their patients very well and give them the healthy life. But now again the question arises, what should be the frequency of being tested or being checked, whether the person was earlier detected with the cancers or now he is a survivor or he is a normal person. What should be the frequency?
I'll divide your question in few parts. First of all, for survivors, as I've told you, screening, this regular checkups are there for every 3 months or every 6 months or once a year. For all the cancer survivors, their treating specialist would tell them what specific tests to done, and plus other tests also required. ऐसा नहीं है कि if the female has got one cancer, she cannot develop other cancers. In fact, as I told you, breast cancer, uterus and ovary cancer are interlinked. So whenever we treat either of these cancers, we get the test done for other parts as well, so that we know our patient is at high risk for other cancers and we need to see them regularly for all these tumors. Then for general population, again, people who have a family history in their family history of breast cancer or family history of uterus, ovarian cancer, these females need to get a regular checkups done. The normal saying is that the last family member who had the cancer at the earliest stage, suppose my aunt had cancer at 35 years of age, I need to get myself checked 5 to 10 years prior to that. She had at 35, I should start my checkups at 25 years of age, and that time I should get regular checkups done, and the checkups will be advised by the doctor. But most commonly what we do is ultrasound of the abdomen. By that we can detect formation of tumor in the uterus, ovary or in abdomen anywhere. We can do ultrasound of the breasts in females who are less than 40 years of age, and in elderly females we can do mammographies, and then normal checkup done. For general population also, annual program, annual screening, annual checkups are advised, and by that we can detect so many tumors, like in chest simple tests like chest X-ray can detect tumors in the chest, mammographies can detect tumor in the breast, ultrasound abdomen, and then pap smear for cervical cancer. Then I will come to the second part of the question, how can we prevent these cancers? Prevention is twofold, threefold. Primary prevention, what I call is our lifestyle modification. We should eat healthy diet, diet rich in fats, diet including smoking, alcohol. All these factors are carcinogens. They are carcinogens in our diet. They are responsible for so many cancers that if we omit these things from our diet, we can prevent, I think, majority of the cancers. Along with good diet, a good lifestyle, active lifestyle, doing more of exercises. As I told you, for so many cancers, obesity is a major risk factor. So, good diet, good exercise, no smoking, no alcohol, not having multiple sexual partners can prevent so many cancers in females. And then secondary prevention, what I call is where we have the role of vaccines coming up. Of all the cancers, cervical cancer is one which has a vaccine to prevent it. You would have heard about hepatitis B vaccine, which prevents liver cancer. Similarly, HPV, human papilloma virus vaccine, prevents cervical cancers. All the females before their marriage or before 25 years of age, if they get vaccination done, the vaccines are scheduled over 6 months. There are 3 divided doses, and if they get these 3 vaccines done, cervical cancer can be prevented in 95% of females, and that is a huge amount. I mean, if you look at the volumes of the cervical cancer in India, 95% protection means a lot. Then comes tertiary prevention. As I told you, a lot of these cancers do not get converted from normal to cancer in a day. There is a time, there is a lag period which we get, where if we can detect and treat the cancer in the pre-cancer stage, then we can prevent cancer formation. So, prevention is at various levels. We just need to be aware of it, and we just need to do something to take care of ourselves.
Definitely, one need to take care of themselves as well as to all the people, for all the people around them. Now the question arises, ma'am, here, because with the changing lifestyle, especially in urban India, if you talk about the urban women who wish to do a lot, and she is making a lot, but now the question arises, somewhere she forgets, or sometimes she tends to compromise with her fertility. Sometimes we have seen a number of the cases when she herself doesn't want a child, and for this she goes for the different alternatives. Do you feel so that this could be one of the major causes for the cancers further?
This is part of a growing problem for all, in fact everybody, not only for oncologists, even for gynecologists this is a problem. As our career choices come first, we tend to ignore fertility issues, but yes, late marriages and late childbearing does cause cancer formation, like breast cancer is one major risk factor, endometrial cancer is also another risk factor, and similarly ovarian cancer. These 3 cancers are somehow linked to late childbearing. Another important issue which I would like to bring up here are a lot of cancers being diagnosed in earlier stage, early age group, and when patients go for treatment of these cancers, there also their fertility is compromised. As I told you about so many cancers, I have said in all these cases we remove the uterus. If this cancer happens in a younger female who has to undergo this surgery, her fertility is compromised. And even if not these gynecological cancers, there are other cancers like leukemias or breast cancer. With our lifestyle, so many cancers are happening in younger age group. Patients are delaying their childbearing because of their social issues, and these cancers are happening in younger age group. So, it is a two-way sword. What does she need to do? She needs to be aware about this. Whenever she goes for any treatment of any cancer, she should be aware there are options available nowadays by which she can preserve her fertility. Simple things like when she is going for chemotherapy, there are simple medicines or injections which doctors can use or give it to her, so that her fertility, her menstrual cycle, that can be preserved. Whenever we do surgeries, like I told you, in all these cases we remove the uterus, but if the patient comes to us in early stage, we can also do uterus preserving surgeries for her, like in cervical cancer. as I told you, cervix is the mouth of the uterus, and we need uterus for pregnancy to happen. So, in these early cases, we remove just a part of the cervix or only the cervix and preserve the uterus. Thereby, she can preserve her fertility and she can have children in future. Similarly, in endometrial cancer, in early stage, very early stage, we can give her some medicines so that her uterus need not be removed, and later on when she has completed her family, then uterus can be removed. For ovarian cancer again, very early stages, or sometime in certain ovarian cancers, like as I told you, in young girls, when they develop ovarian cancer, there we try to preserve the uterus and the opposite ovary so that in future she can have children. Similarly, in radiation therapy, such measures can be taken where the radiation dose does not go to the ovaries and we can preserve her fertility for future.
There is another point or another question which is going inside my mind. Sometimes we have seen that, especially we are talking about the young girls, when they have very unnatural, their monthly processes are very unnatural, very unbalanced. Could we say that it would further give rise to certain kind of problems or pave way for the cancers?
Yes. Most of these times when girls start having their periods, when they achieve puberty, then most of the initial years their hormonal balance is not, there is something we call pituitary hypothalamic gonadal axis. This axis has not matured in early age, it takes time to mature. So, slowly and slowly it gets matured and then girls start having regular menstrual cycle. But not only nature, it is up to us also, like lot of girls come to us, they are obese, their lifestyles are such that a girl who is 14-15 years old, she is weighing 70-75 kg, and then her lifestyle is such, having junk food every day, not having exercise, all these factors lead to imbalance in our hormones and then lead to obesity and then hence lead to abnormal menstrual cycle. Because of this abnormal hormones in our body, there is excess of estrogen. Females have mainly two hormones which balance or regulate our menstrual cycle, that is estrogen and progesterone. Estrogen, what I call is good hormone in one way, that gives us all the nice facial features, but it also leads to formation of cancer in our body. So, excess of estrogen hormones can lead to formation of cancers in their later life. She is having like a common disease, I had told you, polycystic ovary. Lot of girls come to us, they have researched in the internet, there is PCOD, and these girls, if they do not get the treatment at the right time, when they are 60-70 years old, they tend to get endometrial cancer in their later age group. So, these hormone imbalances, these abnormal menstrual cycles have to be regulated, and when we regulate them, we do give them hormones, but the hormones we give them are very low dose balanced hormones. So, when the balance of these hormones, these menstrual abnormalities can be corrected, not only for the present, but as well as for the future.
Now there is another question which suddenly popped out because we have also seen that, or we have discussed with lots of people. Some people tends to take unnecessarily pills for unnecessarily things. Sometimes we are not able to control all the pains. Of course, it is a human tendency. Whenever in fact we have headache, we used to go for a medicine. But do you feel so that the unnecessary kind of pills which we sometimes takes to lessen our pain particularly, so these kind of pills could harm?
These painkillers as such are not very harmful for the body, except fine if you take so many painkillers and they can lead to toxicity of the liver or kidneys, but as such they are not carcinogenic, or we call them, they do not lead to formation of cancers. But yes, if females take hormones for unnecessary, like so many advertisements you have been seeing of eye pill and other things, the television has been promoting it in a lot of way. Similarly, if you take these hormones unnecessarily, they can lead to formation of cancer, or we call them unnecessary intake of hormones should not be done, because these are the ones which can lead to hormonal imbalance in our body and they can cause some or the other problem in future.
Now the question here is especially with regard on the behalf of all the mothers, as we say that mother is a friend of a girl or a female. Now the question arises, should we teach the girls, our daughters, the thing called personal hygiene? The personal hygiene helps a lot in combating with all the diseases such as cancer.
Yes, as I told you about cervical cancer, it is part of a sexually transmitted disease and a symptom, vaginal discharge. So many females have just a simple symptom and they ignore about it. If the mothers teach their daughters about hygiene, what is right and what is wrong, the girls can also detect any abnormality in their body earlier on. So they know, fine, this is having abnormality, they will reach the doctor first. And secondly, a personal hygiene always helps us in combating infection, and it also helps in treating them early, and we can also detect any abnormality.
Because sometimes we have also seen that, or we have heard from lots of people, whenever they have used a very bad washroom, they tend to get infections, or we could say that some people are very prone to infections very easily. So these kind of people should take extra caution that because they are likely to get infections, so diseases like cancer could harm them.
No, cancer is one thing which luckily does not get transmitted this way. But there are other infections like urinary tract infections or simple infections which can be transmitted this way, and they definitely need to take precautions. They need to be very careful about the hygiene, and then if they develop any symptoms, any abnormal urinary symptoms or any abnormal pain abdomen, they should definitely approach their doctor, and the doctor can treat it accordingly. Usually simple antibiotics are sufficient in these cases.
There is a general perception that the people who have very low immunity level tends to get infections or tends to get diseases very easily. Can we say that so is the case with cancers also? If the person has a very good immunity level, the cancer would not dare to touch the person.
Yeah, definitely. As I told you, lifestyle, our eating habits do improve our immunity, and good diet rich in vitamins, rich in proteins, and less of sugar and less of fat, it is definitely good for us. It also boosts our immunity and also prevents cancer. And there are diseases like lot of people, as I talked to you about HIV, AIDS. It's a disease prevalent in India. It is disease prevalent world over. HIV patients are immunocompromised, so they tend to get cancer formations in their body early because their body cannot combat these infections. Like there is HPV infection in our body, so HIV person will not be able to combat this infection, so they are more prone to get cancer formations. Similarly, there are other autoimmune disorders which are responsible for delaying immunity in our body, and these patients also tend to get cancers more. So diet as well as our immune system are all combating together to fight these infections and to fight these cancers.
As a doctor, I would also like you to ask you that because we are talking about basically the female cancers, that is gynecological cancers, should the girls take into account that they should eat more of green vegetables, or they should take care that their hemoglobin shouldn't go down, because in case if they are somewhere affected with certain kind of diseases, they would able to fight?
Definitely, you are absolutely right. Good diet, good hemoglobin count, good proteins in our body, and low fat, low carbohydrate is always good for us, not only for cancers but for all the problems. It is the good diet, green leafy vegetables, जैसे कहते हैं ना, बड़े कहते हैं, ठीक कहते हैं, we should follow a good healthy diet, and that will help us in preventing so many problems, not only cancers, hypertension, diabetes. Hypertension, diabetes are indirectly related to cancer, but they are themselves a very big problem. So if we eat good diet, good exercise, all these our lifestyle modifications will prevent cancer formation, and a good diet will also lead to good hemoglobin. A lot of girls, because sometimes of their menstrual problems, get low hemoglobin. They don't take care of their diet. With good diet, we can build up ourselves, we can build up our hemoglobin, and even need not take up iron tablets. and that will definitely help us.
Now there is a question, as we talked about the vaccines also, that now there are vaccines available with the help of which one can combat with the diseases like cancer. Do we have some precautionary kind of vaccines that the person or the girl or the female should take these vaccines mandatorily?
Yes, these vaccines which I told you about, these are precautionary vaccines. They are not for treating the HPV infection. They are, we call them prophylactic vaccine. This will prevent HPV infection to harbor in our body. Even if the virus comes, we have developed immunity to it. After these vaccines, there are antibodies are developed inside our body which combat this virus and do not let this virus rest or stay in our body, and the girls are protected from this virus infection. And even if the virus is there, it will not stay in the body, it will get destroyed, and the body's immunity will take over and will prevent HPV causing any harm to the body. As I have told you about hepatitis B or poliovirus vaccine, luckily for cervical cancer this vaccine is available, but for other cancers so far we do not have any vaccine right now. It is under experimental, under trial stage, so probably in few years we will get vaccines even for them also.
Now, as you said that anybody could take these vaccines, what is the right age? Could we say that there is a particular age or there is a particular time when one should take these vaccines?
Normally age of 9 to 25 is recommended for these age group for females, and the best time to get these vaccines is before sexual activity started. So, because these are preventive vaccines, and HPV virus is sexually transmitted virus. So, before sexual activity starts, if girls take these vaccines, they can prevent this infection. And in European countries, it is part of the routine immunization program. It has not so far happened in India, but in European countries, in USA, in Australia, it is part of a routine immunization program. And we are hoping in few years, India will also make it as a part of routine immunization, and then we can prevent cancer in so many young girls who will get vaccinated, and also prevent indirectly it prevents virus infection staying in the community. And to tell you, HPV virus does not cause cancer only in females, but it also causes cancer in boys. There are few cancers which happen in males also because of this virus. So, if the immunity against this virus goes up in the society, it will help others also.
We talk a lot about the young girls or the females who are below the age of 30, or we could say that who are at the stage where they are likely to get more affected by the cancers. If we talk about the cancers alone, because we have talked about various kinds of female cancers, that after 40s or 50s or 60s also one is likely to get affected by the cancers?
Yes, most of these cancers present in a later age group, although the cancer formation starts early. Like in cervical cancer, I told you it takes around 8 to 10 years before the cancer presents itself. So, the changes start happening in our body, and slowly these normal cells go and get transformed into cancer cells and present in later stage. For other cancers like uterus cancer and the ovarian cancer, these cancers usually happen in a later age group. Their peak age is around 60-70 years of age group. So, as the life expectancy in India is increasing, so is the incidence of cancer is increasing. And most of these cancers present in later age group only.
As there was a recent publication, recent news in the newspapers that the survival rates in India, if we talk about the cancer, they are very low. Could we say that the people in India are unable to fight with the psychological kind of thing? No, we could not be able to resist this kind of disease, or still we don't have any such modalities or any such preventive measures? No,
I don't believe that. I say, as I told you, our treatment modalities are almost at par with other countries. And but the issue is ki in our country, lot of people present to us at a late stage. They don't present in early stage. As I told you, in ovarian cancer, females have some minor symptoms. They say gastritis ho raha hai, gas ki goli le li. They don't recognize that they can have something serious. They don't approach the doctor. They don't get detected early. And when they approach to us early, the disease is such that it behaves badly. Similarly, other cancers, people ignore their symptoms or do not reach the doctor, or if they go to quacks, or they go to such doctors who are not, who do not know about these cancers or cannot treat these cancers. And when there is inadequate treatment, inadequate diagnosis or a late diagnosis, then of course our treatment results will be poor.
Though we tend to know about the cancers at the very later stages, as you said about the endometrial cancers, where we don't tend to get the symptoms in advance. If you talk about the other cancers, for example, ovarian cancers or cervical cancer, what are the symptoms one used to get generally, if you talk about?
Most common, I say, for all the cancers, anything abnormal, abnormal discharge, abnormal bleeding, abnormal pain abdomen, or anything abnormal you feel with your body, approach a doctor, because most of these cancers have vague symptoms. There is no one particular symptom that will say, okay, fine, this symptom is equal to this cancer. So most of these cancers will have vague symptoms. So anybody who has abnormal discharge, she has been treated for infection, but there is no response and the symptoms do not subside, or if there is any abnormal bleeding, if there is bleeding in between the normal menstrual cycle, or if there is any bleeding after the menstrual cycle has finished, or we call it postcoital bleeding, any of these abnormal problems, approach a doctor. These could be warning signs to the patient, these could be warning signs of cancer, and if we can see and we can treat them, we can treat cancer.
You told us about the pap smear method of detecting or testing. How frequently one should go for this kind of test?
Pap smears are simple tests which can be done easily, and normally we say any female who has got a normal pap smear finding and her, as I told you, another test which is HPV virus, if these two tests are normal for next 3 to 5 years, she does not need any screening test for cervix. If she has done only a pap smear, then for 3 years also, if it is a normal, she can get another pap smear repeated after 3 years. But yes, if there has been any abnormality in the pap smear which should be treated and can be treated by simple methods like simple medicines or simple local treatment, she should get a treatment done and then accordingly follow the advice of the doctor. Normally what we do is, whenever a lady has an abnormal pap smear, we follow her closely. We ask her for examination, to come for examination every 3 months or 6 months, and normally we repeat pap smear once a year for these females if there has been any abnormality which has been treated, so that if the abnormality recurs, if the abnormality comes back, we can treat it again and then we can follow her up accordingly.
As we have very less time left with us, now the only question or only suggestion from your part, because I believe that lots of people might be watching us right now, especially the girls, or they would be watching us with the help of the YouTube. We tend to post our lectures, upload our lectures daily on the YouTube, but now I would like you to give us some suggestions so that the women community as a whole would be aware of this particular kind of cancers, what she should do and what she should not do.
I believe first of all, women should love themselves. They should know for them they are important. They are important part of the family. They are important part for the, not only for the family, for the whole community. A healthy woman is a healthy home, is a healthy community. So if you have any problems, don't hesitate. Don't feel shy to go to a doctor. We have so many female doctors in India. You will be surprised if you go to other countries, there are not so many female doctors. In India, we are lucky to have so many female doctors for you. You can go to a doctor, get yourself examined, get yourself checked up, get proper treatment done. If you take care of yourself, if you are healthy, your family will be healthy and so will be the society.
Dr. Bhatia had laid a very important point over here, because we tend to feel shy. We feel that no, how could we tell a doctor our problem, but doctor is a doctor, he is not a male or female at that time. And as she said that we have lots of gynecologists, lots of female doctors in our country. So you should take care of yourselves, and especially you should take a pledge that we would fight against a disease called cancer. Thank you, Dr. Shruti. Thank you so very much for being the part of the EduSet lecture, and I believe that in future lectures also we would be conducting more such issues we would be talking about, so that the lots of people would be aware of such kind of diseases. Thank you, ma'am. Thank you so very much.